Hi, I'm Dr. James Goolnik, an holistic dentist from London in England. And for the past 30 years, I've been fixing teeth.
So a little bit about me. I practice in London in Baker Street. Nearest tube is Baker Street or Marylebone Station. And we have a multidisciplinary team, which means there's lots of people in the team trying to help people get healthier. And our philosophy is all about optimal health begins in the mouth. So whatever is in the mouth can have a systemic effect on the rest of the body. I'm a practicing dentist, and I've written two books. One is called Kick Sugar, which is a cookbook to try and get people to enjoy food without having loads of added sugar and carbohydrates. And the other book is called Brush. It's all about marketing and getting the right people into the right places. So this is our team. You can see there's quite a lot of us here, and we have pediatric dentists, we have implant specialists, we have biological hygienists, nutritionists, myofunctional therapists, psychotherapists, osteopaths. We have airway and breathing specialists, and we have an implantologist as well, who can help replace missing teeth with ceramic or metal-free options.
But we don't just fix teeth, we reverse cavities. Most people think that cavities are a one-way disease. Once you've got one, the only thing you can do is drill it. But what if I told you there was another way? What if I told you can actually reverse cavities by changing very simple things? So stick with me, and I'm going to teach you the ways to naturally reverse a cavity and no more dental disease.
I'm a holistic or biological dentist, and I'm here to spend a few minutes with you talking about oral health myths dispelled. And I have 5 myths that I'm going to dispel with you. So, number one myth that we're going to talk about today is oral health is cosmetic. It isn't cosmetic. And the interesting thing is the tongue is the barometer of the whole mouth. You might have seen about Chinese wisdom where you stick your tongue out and they can tell you what's going on. But actually, you can actually show more than 10 different diseases from the color of your tongue and the texture of the tongue, whether that's diabetes, vitamin B12 deficient, or iron deficient anemia. And there was a study done last year where they took photographs of tongue and put it into AI software, and they were 94% accurate for looking for anemia, kidney disease, and diabetes. So that's one thing to have a look at. Tongue, to see what's going on. And whenever you go and see your dentist, your doctor, get them to have a look at your tongue, because that will show you a lot more things of what's going on everywhere. And these are all the different signs you can see in the mouth of tongue issues. So you can see diabetes, that's a big thing. You can see cardiovascular disease, so heart disease. You can see autoimmune disease with mouth ulcers, so things like SLE, systemic lupus erythematosus, blood disorders, bleeding disorders, and HIV and GI tracts with mouth ulcers as well, so something to have a look at. And it's all about what's in our mouths. So the idea with our mouths is that we've got a whole mixture of bacteria. We want good bacteria and bad bacteria, and they're all living in harmony, and we can't survive without these bugs. And it first was invented in 1683 by Anton van Leeuwenhoek. And what he did was actually hadn't brushed his teeth for 3 days, and then took the sample and put it under the microscope and had a look and see what was going on. And from those bugs, he could actually see, and the picture on the top right-hand side is Streptococcus mutans, which is a bacteria that can cause tooth decay. So he was looking at that and showing us what was going on there. And we actually, the microbiome in the mouth is the second most diverse microbiome, which is connection of bacteria, protozoa, and viruses to the gut. And you will hear about the gut microbiome with Zoe and things like that, and gut microbiome tests and stool tests. But actually, the mouth is the entryway to it. So the mouth is the first place to go. And you can see in the mouth there's loads of different types of bacteria. And if you ever have a microbiome test, you'll see in all different spaces, in the teeth, the tonsils, back of the throat, they all have different populations of bacteria and things here. This is quite interesting. You're going to see here is on the top hand side, you can see the beforehand. This is patients who came to see us, and we took a swab from their mouth, and we're looking live at what's going on. And you can see here, especially on the top left-hand side, all the bacteria, and you can see spirochetes, and they're all basically having a party because there's so many bugs in there. And then the patient on the right-hand side wasn't quite as bad. You can see some white blood cells as well, showing signs of infection. And then after they had treatment with the hygienist and went through the brushing and cleaning techniques, you can see everything's a lot calmer. There's still bacteria in the mouth, but there's not as many bacteria in the mouth. And that's something that's really important for us to have a look at. And one of the most common bugs in our mouth is called P. gingivalis or Porphyromonas gingivalis, and that's the one that can cause gum disease. And that actually, when you get these bacteria in the mouth, it should stay in the mouth. It shouldn't be anywhere else in the body. And when you have inflammation, the gums pull away slightly and you get bleeding, and then the bacteria that are there can actually then go into the bloodstream and either can go up into the brain, or you can inhale them into your lungs, or you can swallow them, and if you haven't got enough stomach acid, they can go into your intestinal tract as well. So this is just showing here that the P. gingivalis can actually go into the brain, and shown in Alzheimer's disease, in cardiovascular disease, heart disease, obesity, diabetes, any sort of chronic inflammation like rheumatoid arthritis and cancers as well. So it's really important to keep this bug as low as possible. We want some of it, but we want lots of it, and that's one thing you can do. And you can see here on this slide, this is a patient that had a dysbiotic mouth. So this is a person who had bad breath, and you can see all the things that are going on in their mouth, which is what we want to try and get rid of. So what sort of causes all of this? And there's a few different things. So first thing is you have lots of antibiotics. Antibiotics can disrupt the oral microbiome, and you're going to get more and more infections and problems there. Oral hygiene, if you're not cleaning well, then you get more of one type of bug than the other. Diet, depending what you eat and drinking, if you're having a lot of sugar and refined carbohydrates, processed foods, that can affect the microbiome. Alcohol, regular alcohol use, or even alcohol mouthwashes can cause these problems. Any sort of disease can affect the microbiome. So you've got a cold or flu or anything that affects it. Certain medications can actually make a difference with it. Obviously, your salivary flow, so if your flow of saliva is not as good, if you've had any sort of chemotherapy or you're having drugs that affect your saliva, that makes a difference. Some people, it's genetics, and also smoking can make a difference. And now they've been showing actually that vaping makes a difference as well. So why is the oral microbiome so important? There's a big correlation between what's happening in the mouth and the rest of the body. So if you've got problems with mouth health, you can have 25% increase in heart disease, cardiovascular disease as well. You've got 3 times increased risk of diabetes as well with gum issues. You've got a 20% increase in hypertension, which is high blood pressure. You've got a 3 times increase in obesity. There's 70% increased risk of Alzheimer's disease, and then SLS as well, and then squamous cell cancer. But all of these things are all about low-grade inflammation. We talk about chronic inflammation that's been on for a long time. And the most studied one is about diabetes and the body. So actually, there's what we call a bidirectional link. So people with diabetes have worse gum disease, and they have more obesity, and vice versa. If you've got gum disease, you're more likely to be obese, and you're more likely to be diabetic. So if you've somebody who's diabetic, and we work on their gum disease, we can actually improve their diabetes as well, and vice versa. So it's what we call a bidirectional link between the two of the things. And there's obviously bigger issues as well with certain of the bugs can actually cause more problems. They go to the joints and the muscles and go to the heart, and also certain type of cancer. So that's why the mouth is really important, and the bacteria is really important in it. The other thing people think about is about how they can brush better. So they say, oh, it doesn't matter, I've just had a sweet, I'm going to brush my teeth straight afterwards and that will get rid of it. But actually, you can't outbrush a bad diet. It doesn't matter how much you brush afterwards, it will remove the food debris, but you're eating that, you're swallowing it, is causing a systemic effect. So you can't affect it. And stress makes a big difference on our mouth health as well. So if you're more stressed, you're more likely to have a microbiome or bacteria that causes gum disease and tooth decay than anything else. So really important to work on the stress. This is a new paper to show actually there's a bacteria in the mouth called Fusobacterium nucleatum, which is not it's not found anywhere else but the mouth. But now they've been finding it actually in the colorectal area, so in the GI tract. And actually they were finding that these cancers had 50% more Fusobacterium nucleatum. So we need to get rid of it from the mouth, so therefore it doesn't go into the gut and cause further problems. There has been loads and loads of research on diet and how it can help grow your jaws and make sure everything is functioning better. And this is a dentist, Weston A. Price, in 1939, wrote this really interesting paper about the difference of the Aborigines when they moved to Western areas. They had more tooth decay, had more crowded teeth, and have smaller jaws. and they were because the foods were softer and they weren't chewing as much as well, and it made a big difference to all of that. So how do we get as much nutrients in our body as possible? Now, obviously it depends on the food source, so if it's organic and where it comes from, the cooking method. So for example, vegetables, if you steam them, you're going to get more nutrients in them than if you roast them or boil them as well. The content of your meal, and then other things, the soil quality and how well your sort of digestive tract is at the moment. We've got a free guide to what biomarkers that are useful for oral health. So if you're interested, just send us an email below, and we will send you a free biomarker. So that tells you all the ones that are really important, what blood tests to do, what saliva tests to do, that make a biggest difference in it. And for us, the key marker is a thing called vitamin D. It's actually not a vitamin, it's an enzyme. And actually this, we can naturally make it in the sun, but in the UK, about 80% of us are deficient in vitamin D. You can also get some in your diet, some oily fish, some like salmon and mackerel, and also you can get it in butter as well. So looking at vitamin D and how it makes a big difference to oral health, it's the big driver. And you can get a blood test. We do here at Optimal Dental Health, finger prick tests. You can go to your doctor and get a phlebotomy blood draw and see. And ideally, we're looking for between 75 and 125 nanomoles per litre. And that's the best result to make sure you heal quickly, your bones are nice and strong, your immune system is gone, and you find you have less infections and less problems. And we like combining it with K or vitamin K2. So a lot of times when you buy nutrients and you buy your multivitamins or you buy your supplements, they have D3 and K2. So if you can buy them together, that actually facilitates the role of D, and it's also good for blood clotting as well. So the other thing we try and get with our patients is to try and get people to breathe through their nose as much as possible, because the nose naturally filters the air, warms the air, and as part of the immune system. And if you're breathing through the mouth, you don't have that filtration, you're more likely to get coughs and colds and infections. Also, you tend to breathe quicker as well, and your mouth dries up, and then there's more chance of having mouth cancer and also tooth decay as well. So really working on trying to get people to breathe through their nose as much as possible, and that really improves gum health. And just shows you here about all the different things with mouth breathing. Now, obviously, we always suggest people to start with mouth tape first, and you can do it during the day, just for a sort of half an hour to an hour a day for a week. And if you manage to breathe through your nose and you're comfortable with that, then you start doing it overnight, and that will mean that you'll wake up more refreshed and have more energy for the day. So these are the sort of the benefits of mouth breathing and nose breathing. So for nose breathing, you get fresh breath, healthy gums, less cavities, less ulcers, and much nicer microbiome. And then if you're somebody that snacks occasionally, one of the things you can do to try and cut down on decay and problems with snacking is you can use xylitol chewing gum. And xylitol is a sort of sugar alcohol, and it actually naturally occurs in certain fruits and vegetables, but you can buy it in gums and mints. And so after each snack, you can have that, and that helps increase the salivary flow, washing everything away, neutralizing the acid, and also stop some of the bacteria sticking as well. So things you can do to improve your microbiome: don't share toothbrushes or little sticks. Tongue clean, so try and clean your tongue at least once a day, 3 scrapes, and you can use a spoon. You don't need anything special to do it, and that will help fresh breath and also help blood pressure control. Using some sort of floss or interdental brushes. Try and avoid mouthwashes. Avoid antibiotics as much as possible. Only need them if you really need to. And then stay hydrated as much as possible you can to increase your hydration. Breathe through your nose and eat a varied low sugar diet, and limit ultra-processed foods, and try and promote breastfeeding. And our last thing is be careful who and where you kiss them, because you will share the microbiome. Point number 3 is toothpaste is optional. So toothpaste is actually there to remove staining, and it's a medication to actually help harden your teeth and stop sensitivity and reduce tooth decay. A lot of the times in the UK we talk about fluoride, and fluoride works, and fluoride definitely works to harden your teeth, remineralize it, slows down decay, but it works as a topical effect, so it works just on the surface of it. And if you have too much fluoride, you can cause fluorosis, and there's a question mark with neurodevelopmental defects as well long term. So ideally just brush with water. If you've got a lot of staining, then you can use bicarbonate of soda or something else. And then this is talking about where in the UK the area is fluoridated, and you can see the UK is about 10% fluoridated. And if you're worried about fluoride, there are only two sort of tried and tested ways to get rid of it. One is RO, or reverse osmosis, and the other thing is activated alumina, which are filters you can have in your water system to remove it. There is a product though that was working as well as fluoride now. It's called Hydroxyapatite. It's actually naturally in our teeth surface already, and that is a safe alternative to fluoride, and it will help harden your teeth and reduce sensitivity as well. And in 2023, they did some surveys and actually found that nano hydroxyapatite is the safest one, using up to 10%, and that's the one that's most evidence-based. There's loads of different types, but that's the one that's most evidence-based. But if you're going home now, look at your toothpaste, try and avoid one that's got SLS, sodium lauryl sulfate, which is like a foaming agent, and also with any sort of microbeads, triclosan, titanium oxide, which are all colorants, and you want an RDA value of under 70. So if it's over 70, that's a worry, because that shows basically the relative dentine abrasivity, which means it's basically how rough your toothpaste is. And so the carbon ones, the whitening toothpaste, they can be very abrasive and cause loads of problems and mean that your teeth will become more sensitive, more thinner, and wear down quicker. Nearly there. Number 4, bleeding gums are normal. So actually, if you brush your teeth in the morning, spit out, if you see any blood, that is not normal. That basically shows that the gums are inflamed and you've got one of these things called a cytostorm. And it basically means all the bacteria are getting in through the gum membrane and actually getting into the bloodstream and causing generalized inflammation. And then you get these pro-inflammatory mediators that you can see here, and then it all passes on to other sites in your body, whether it's the heart, the brain, the lungs, the fatty tissue in your joints, in the intestine, and kidneys as well, and pregnancy as well. So they do cross over. So that's called leaky gums. So we want to make sure that is gone as much as possible. And you've got a picture here with somebody with inflamed gums and swelling and bad breath as well. So if you've got bleeding gums, you need to be going to see your dentist. And last point is, all mouth bacteria are bad. There's lots of mouthwashes out there that they say they kill 99% of bacteria. We don't want that. We need the bugs in our mouth to help digest food, to help produce enzymes, to help produce vitamins and minerals, and we need them all to be in a symbiotic relationship, so be happier and healthier. And you can see here on the left, this is an oral microbiome test, and actually looking at what you're healthy compared to something else. And then we can do these tests and we can show you your medium risk or high risk for dental decay, dental caries, and we can look at that. And the ways to sort of change that, you can look at probiotics, which are live bacteria, to try and encourage growth. You can actually then use high dose of antibiotics targeted different things and certain mouthwashes for short time. And this is a picture of tooth decay, and again, down to combination of food, it's combination of what you're eating, how often you're eating it, and the time as well. So you see, you need the sugar, the food, substrate, you need teeth to get tooth decay, it needs at least 3 months to work, and you need certain bugs to do it. So some people have more decay producing bacteria than others. So what we're looking at is what we can do to help change that for you, whether that is working on the saliva, working on your vitamin D levels, working on your snacking, or protecting the teeth with hydroxyapatite or something else like that. And it is possible to reverse tooth decay. It takes about 3 months. There are various different peptides that your dentist can place on to actually help remineralize or harden your teeth. But it's something that you need to really work on together, and you need to go through a diet sheet and everything else. And this is a thing called a Stefan curve, which shows us what we want is the pH of our mouths to be as neutral as possible and stable throughout the day. And every time you eat or drink anything, the bacteria produce acid, and it goes below 5.5. And you can see on that screen there, 5.5 is the level where the tooth starts to dissolve and what we call demineralize and decay. So what we're trying to do is keep the curve as high above that 5.5 as much as possible, so reducing the number of times you're eating and drinking during the day. And then when you do have a dip, when you eat something, bring it up as quickly as possible, which is having water afterwards, some cheese or something to neutralize whatever you've eaten, whether it's brushing, whether it's using xylitol, mints or gums as well. But ideally, the first thing we do is try and increase the gaps between each time you eat and drink to make that easier. And then also there's been loads of studies on Alzheimer's disease and how there's a mouth connection to Alzheimer's disease. And Dale Bredesen, one of the neuroscience in the US, who did a lot of work on this from 2016 onwards and looked at the different things that can have an impact on Alzheimer's and cognitive decline. And in the mouth health, there were three pivotal things. One is the bacteria, so the microbiome, to see what bacteria and protozoa and fungus and viruses in your mouth. Second thing is on sleep apnea, we talked about earlier on, is making sure that we have enough oxygen saturation through our at night when we sleep, and we want to really make sure that oxygen saturation is 95% and above. And if it isn't, then we need to look at how we can make appliances or something to encourage you to breathe through your nose, and also encourage you not to block your airway. And then the other thing is heavy metals, in particular mercury and metal fillings can cause people to have more issues in their mouth. So sleep is a big thing, and we work a lot with patients on sleep. We do overnight sleep tests and just see, you can use Oura rings or Whoop bands or Apple Watches or some way of tracking and looking at your heart rate variability, look at your heart rate, and then look at oxygen saturation throughout the night. And these are some devices that we can make called a mandibular advancement splint, and basically is like two mouth guards joined together, one at the top, one at the bottom, and it actually keeps your jaw open and your lower jaw from falling back and your tongue dropping back to block your airway at night. And this is a very simple test you can do overnight to actually see, are you snoring, are you breathing? Almost done now. We're just talking about mouth ulcers, very common. You can get them from trauma. You can get them if your toothpaste has something called sodium lauryl sulfate, which is like a foaming agent. Some people get them with celiac disease or gluten sensitivity, with candida, certain nutrient deficiencies. So if somebody's coming with me with multiple mouth ulcers and they're getting them all the time, stress is a big thing, but vitamin C, D, iron, B12 and zinc, you should check those out, because sometimes you get the first sign is actually of a zinc deficiency as a mouth ulcer. So if you can correct the zinc, you'll stop the mouth ulcers. Hypochlorhydria, microbiome dysbiosis as well. So again, so if we've got a mouth ulcer like that, these are the tests we would do: full blood count, iron panel, zinc, B12, vitamin D, vitamin K, HbA1c, which is like blood glucose control, and magnesium as well. And then you can get these tablets that can help try and slow down the infection. But the most important thing is to try not to touch them so they don't get secondary infected. But if you had an ulcer that hasn't healed after 2 weeks, you need to refer. So this is us, Optimal Dental Health. We get as much information as possible. We spend at least an hour with you to find out about your sleep, your hydration, your exercise, your stress, and nutrition, what diets you have, what supplements you have. Then we do tests to see what's going on with whether it's blood test, overnight sleep test, or x-rays, and we can do 3D x-rays now rather than 2D, and you can actually see what's going on in way more detail. And you can see on this x-ray there was nothing going on, but somebody had pain in one of their teeth. And when we do a 3D scan, you can see a big ulcer there. We collaborate with loads of other specialists. We work with osteopaths, we work with chiropractors, we work with functional medicine doctors, normal doctors, nutritionists, and trying to find out what the root cause of why things are going on. Our big philosophy is always food first, then we look at supplements for short term and where the areas are missing, and then looking at treatment and then retesting. Did it work? How do you feel? Do you get more energy? Do you sleep better? And are you getting less tooth decay and less gum disease and less bleeding and less bad breath? So we're looking at various markers so we can see, does it work? So from today, hopefully you've learned a little bit about nose breathing and how that's most important in trying to encourage yourself to breathe through the nose as much as possible. Cleaning it using a tongue scraper at night, just once a day, to help remove the bacteria and freshen up your breath. Always asking about the mouth and have a relationship with the biological dentist.
So before we dive in, what's the one habit you can change to make a difference? Would it be snacking less, eating less sugar, maybe brushing more or flossing? Put some comments below, and don't forget to save this video for later. The daily choices you make a big difference to whether you reverse decay or it keeps going. So what are you eating? Are you eating rubbish all day? Are you snacking multiple times a day? Or are you eating things that are good for your body? Now here's the exciting bit. Most people feel that cavities can only be treated with fillers. Well, actually, there's another way. You can reverse certain cavities and you can stop cavities in your tracks. So it's simple. People think it's expensive or it takes a lot of work, a lot of willpower. But actually, I'm going to share with you some simple tricks and tweaks that you can make to your daily habits to stop cavities in their tracks and reverse them and save you a fortune in dental bills. So let's talk tooth decay. Tooth decay is the most prevalent disease in the world. So what's prevalent means it's happening everywhere. Most people have got some sort of tooth decay somewhere, but it doesn't have to be like that. And I'm going to help share the secret that a lot of dentists don't want you to know about how you can actually stop tooth decay and actually reverse tooth decay. So what's amazing about this course is you're going to get this free workbook. And this workbook is probably worth £200 on its own, and you're going to get it for no cost at all. I'd love you to download it now, save it, just in case the video moves somewhere else and you lose it. So save the workbook, share it with your friends and family, because it's got loads of valuable tips if you want to reverse decay and you want to get your mouth healthy again and reduce your dental bills. So what's it got in it? One of the things it's got in it is a 3-day food diary, because a lot of the time we forget what we eat and drink. And this gives us a really good snapshot of what we're eating and drinking. And I want you to fill in everything you eat and drink over the 3-day period and how you felt afterwards as well. Because you might have had that burger and then half an hour later feel really slow or sluggish. So what you can actually do to see about what foods trigger you and how it works. And a 3-day diary works really well. You can take it to your dentist or your hygienist and talk them through it. Or you can send it here. If you're interested, we can give you some feedback on what things you can take. But we're looking at foods that you've got to enjoy them first. There's no point having stuff that you don't enjoy, but I want foods that help nourish you, help grow you, make you feel more energized and feel more alive, rather than things that make you feel slow and feel resentful and wish you hadn't eaten them as well. So it's really good tip to do it for the next 3 days and actually see what works for you, because you often forget what you're eating and drinking, and that works really well for you as well. So what else is in the workbook? What else have we got in here that can actually help? We're talking about daily habits as well. So what habits can you put in? It might be something as simple as starting to use your tongue scraper every day and how you feel after that. It might be something about meditation. It might be in the 3 o'clock slump in the afternoon, instead of grabbing that chocolate bar, you go for a walk, or you ring a friend, or you do something else like that to help nourish you. Because we shouldn't be using food or sugar as a way to reward ourselves. There are much better ways of rewarding ourselves, because you're not rewarding your body long term with that tactic. So get your workbook, download it. There's loads of different things, and then looking at oral health products. It's got loads about which products you should be getting in the bathroom, what you can help. Give you loads of notes as well to actually track what's going on with everything else, and then seeing how you improve. And I'm hoping you then go to a dentist, take your workbook in, they fill it out, give you a sticker and say you've done a great job, you've had no cavities, and you've had no fillings as well. So if you've got to think back at the science now, we're going to go back to school. Why do some people get tooth decay and other people don't? Tooth decay is a bacterial infection, so you need bugs in your mouth. So if you haven't got the bugs in your mouth, you're not going to get tooth decay. If you haven't got teeth, you can't get tooth decay. And it also needs time. Most cavities take at least 3 months to form. So if you have one night and you have some chocolate, you're not suddenly going to get tooth decay the next day. It takes time. It's repeated exposure. So what we're trying to teach you in this course is actually, first of all, break one of those habits. So one habit is easy: take all your teeth out, you'll have no tooth decay. However, that's not something that's acceptable for most people. So what can we do? Try and cut down on your snacking. That's the first thing, because your body naturally wants to heal itself. We all have this magic stuff called saliva, which helps neutralize our acids and helps get our pH, which is the sort of how acid and alkali our mouth is, back to normal. So if we can neutralize that acid, we're not going to get tooth decay. So when you have your chocolate bar, you're going to find within 10 minutes, your pH of your mouth gets more and more acidic. So it gets very, very acidic, and it starts to burn holes in your teeth. So it's actually not the bugs that cause tooth decay. It is the fact that you're having the bugs in your mouth. They eat the sugar and they produce acid as the byproduct, and the acid makes holes in. So the more you feed those bugs, the more acid is produced. And your saliva helps wash that away. So it washes the food away, washes the chocolate away, and helps bring that pH back up to neutral. So what we can do is, if you're going to have anything sweet, try and have it in one big hit at once, rather than having it over an hour period. Because if you have a chocolate bar over an hour, basically you're dipping your teeth in acid for an hour. So that's the first thing we can do, is reduce the frequency. have it in short periods of time, and then try and get your saliva to help remineralize or to repair the damage that's happening. And throughout your day, when you're eating, you're going to have acid and alkaline all the way through the day as you snack. So if you can try and reduce the number of times you eat to ideally 3 times a day, and don't snack in between or have healthy snacks in between, you're going to find that that would be the first way to actually stop tooth decay and start reversing it and have more and more foods that are actually healthy for your teeth. And we'll talk about that later on in the course, about what you can have, what you can't have. But think about this acid-alkali balance and try not to snack as much as you can. And a lot of people snack because they're bored. So it's like 3 o'clock, are you one of these snackers at 3 o'clock, you think, oh, and you eat something. But actually, you might be just bored. So when you next feel like you need a snack, get up at your desk, go into the fresh air, go for a walk, have water or something, do some exercise, ring somebody, but just don't go for that snack. The second thing you can do is actually hide the snacks and not buy them in the first place. So rather than have the chocolate bars, the crisps, the sweets in your drawer, put something else, put some fruits, vegetables in there, some nuts or something that will actually help nourish your mouth. So that's the first thing you can do, is look at reducing the snacks and stop hiding all these things. So hopefully you're still following all this and we're learning more tips about it. What else can you do to reduce tooth decay? Well, there's a magic ingredient called hydroxyapatite, and it's actually in our natural teeth. And our teeth are the hardest substance in our body. And having something like hydroxyapatite helps remineralize your teeth and rebuild your teeth. And a lot of toothpastes have fluoride, and we're going to talk a little bit about fluoride in a minute, but hydroxyapatite is what you're going to be looking for. So if you're looking for a toothpaste, try and find something with hydroxyapatite and try and use that toothpaste twice a day. And it works as a topical effect, so it works to harden your teeth and make them stronger, reduces sensitivity, and it can help remineralize your teeth if you're using the hydroxyapatite toothpaste. Now, fluoride, I, as a holistic dentist, don't believe in fluoride. Fluoride does work, it does protect from tooth decay, but it also affects the microbiome, and also they've shown that it goes across the blood-brain barrier, and in some children it can actually cause some difficulties. So loads of studies, and I'll put some links to studies later on, you can see of how fluoride is a neurotoxin and can cause problems. And fluoride only works as a topical effect. So it works as hardening the outside of your teeth, but it doesn't work if you swallow it. If you swallow it and drink it and fluoride in the water, it won't harden your teeth, it won't do anything else. And our body is not naturally deficient in fluoride, so we don't need fluoride. So if you're having a healthy diet and you're not snacking, you're not having too much sugar and carbs, you don't need any toothpaste at all. We just use toothpaste to actually clean the teeth, remove the stains from tea, coffee, red wine, soy sauce, things like that. But also you do get it from freshening your breath, and some people like it to whiten your teeth. But you don't need fluoride for that. So if you're looking with a diet, but if you do have some sugary things, you do snack occasionally and you've had decay before, you're trying to reverse decay, then try and use something more natural like hydroxyapatite. So look for a toothpaste with hydroxyapatite. We'll have some links in the videos where you can get some free samples of toothpaste. You just pay for the shipping as well. So that's one thing you can do. So looking at snacks. And the other thing is see how your body responds to sugar. Everyone is different. So you might find that if you had a chocolate bar, you're going to get more decay, whereas if your partner has one, you don't get decay. And that's all about the thing called the oral microbiome, which is basically all the bugs in your mouth. Everyone has different bugs. And some people have bugs that cause tooth decay, some people have more bugs that cause gum disease, and some people have bugs that cause bad breath. And you can do a thing called a saliva test or oral microbiome test, where you spit in a tube and you can send it off and you can get a report, and it shows you exactly what bugs you've got, and if you're more likely to have sweet tooth, or if you're somebody that actually is more likely to have gum disease and gum issues, and then you know how much you need to do. So if you're interested in diving deeper, you can look at getting an oral microbiome test, and we do have a discount code for that as well. So if you want to do that at Optimal Dental Health, we can do an oral microbiome test as well. So that's something you may be interested in. So everyone is slightly different with genetics, so look at that. But then look at how your body responds to that. And you could do something like a continuous glucose monitor, which is a little device that goes on the back of your eye, and you might have seen people putting them on, a little plaster over the top, and it measures what we call interstitial fluid, which is basically the fluid around your vessels, and it will measure what your blood glucose is. And the idea throughout the day with your food and your drinks is that you have a nice stable blood glucose level throughout the day. We don't want any peaks or troughs. or anything else, because it means that your liver is working overdrive to release insulin and release blood glucose storages. So what we're trying to do is keep it nice and even. So that's why not snacking, and then looking at what your diet is and how your body responds to food, because everyone is different. So you can buy these little things, and Lingo does one from Abbott, which is a 14-day trial, and you wear it 14 days. It connects to your smartphone, and it will show you what your blood glucose response is. So you can tell, oh, when I have this, I don't feel so great, and this is what happens to my oral microbiome. And for me, I had a pastrami sandwich, and when I had that, actually the meat and the sugar in it caused a big spike for me. So whenever I had any processed meat, I get a big spike, and I know that. So then I can modify it. And it might be that you can change the way you eat. So rather than having carbohydrates first, so you can actually have vegetables first, and that helps layer your stomach, and it means that your blood glucose level doesn't spike as much. So there's lots of things you can do, and lots of wearables to actually measure this. So you want to avoid sitting in the dentist chair. Well, I'm going to show you how you can do that. Number one thing is food, nutrition, diet. How you eat, what you put in your mouth makes a huge difference to whether you're going to be sitting in this chair for a few minutes or a few hours. Second thing to do is obviously how you look after your mouth at home. So how do you look after the teeth, the gums, and your oral microbiome? The oral microbiome is all the bugs that we all have in our mouth. And we have a combination of bacteria, viruses, protozoa, and fungi. Everyone has it, but everyone has a different amount of it, of the ones. And what you want is the good ones, and you want to avoid a thing called dysbiosis, where some of the bad ones are really having a party, and the good ones are being sort of suppressed and kept quiet. So what can we do? Home stuff. First thing is a brush. So if there's an electric brush like this, we really like electric brushes because they usually have a pressure sensor, and if you push too hard, it tells you to slow down, or the light comes on or it stops. And also it gives you a chance to brush for 2 minutes, because most people don't brush long enough. So we want 2 minutes, 30 seconds, 30 seconds, 30 seconds, 30 seconds, you're done twice a day. Research shows that that is the best way to keep everything down and keep everything clean. So that's the first thing with the brushing. But then also the brushing doesn't get rid of everything. So you want to look at getting in between the teeth. And there's loads of different ways to get in between the teeth, but I quite like little brush sticks like this, or some eco floss like this. But you need to get in there regularly to disrupt the microbiome. And that needs to be at least once a day. You choose when you want to do it, but if you have the optimal time, you do it just before bed, and you're cleaning the surfaces, and you're getting rid of the plaque and disrupting the microbiome. But it needs to be something that is really tight fitting. If it goes in really easy into the gap, it'll push the food out, but it won't physically rub the teeth surfaces. So you need something that will rub the teeth surfaces to get rid of the plaque and the bacteria, and actually help you have a healthy mouth again. So that's the first thing, is actually using these brushes twice a day to clean it. And the other thing you can do, you can call it a tongue scraper. These are great, and what they do is everyone has little hairs on their tongue, and you use this tongue scraper just once a day. You choose when to do it, and it's 3 scrapes. 1 scrape in the middle, 1 on the side, 1 on the side. Just gentle pressure. What it does is it removes all the food, bacteria, and aerates the area. Because a lot of the bugs in our mouth don't like oxygen. So that's why if they hide under the gum, under the tongue, between the teeth, and if you get oxygen in them by using a scraper or a floss or something else, you disrupt them and you cause the good bugs to go back in again. So using a tongue scraper will give you fresh breath, make your food taste better as well, but it also helps control your blood pressure, because there's a thing called nitric oxide, which is a gas that we produce on the back of our throat and our tongue. And if you keep your tongue really clean, you produce more nitric oxide, which helps regulate your blood pressure control. So if you're on high blood pressure tablets, tongue scraper is one of the best things you can do to that. And then obviously what you're going to use. We talked earlier on about, I love Hydroxyapatite toothpaste. There's loads of different brands out there. A company called Gutology do an offer where you can get them free and just pay for the shipping as well. So that might be something to have a look at. We'll put a link below for the show notes so you can have a look at that. So what else we're talking about? So if you're looking at to avoid the dentist, and I suggest first of all that most adults go to the dentist at least every 18 months, because we're looking for an oral cancer screening. So we're looking for mouth cancer, and depending if there's a history in your family of mouth cancer, or if you smoke or drink alcohol, you'll have alcoholic mouth rinses. That can make you a higher risk. So go to the dentist to do a screening for that. Just go through brushing and cleaning techniques, see what's going on, and check your mouth to see what's going on with them. And also if you've got any fillings or anything, we can monitor them. And if there's something that's starting for early decay, This whole course is about reversing decay. So you want an expert to show you where it is, and then they could look at different tips and tricks that you can do to help. And there's also products out there. So there's a product called Vivardis it's called Curodont, and it's a liquid. And what we can do is we can clean the surface of the teeth. If we find on the x-ray, or we look clinically looking and we see early decay, which often is a white patch first. It's called demineralization, where some of the mineral content of your tooth is gone. It goes white first, then it goes into brown, and then it starts to cavitate, where you get a little depression, a little hole in the tooth. And once it gets through the enamel, then we're going to have to do a filling. And what we're trying to do is stop it before it gets to that process. So we can see as a professional when we're getting to that process, and we can try and arrest it, stop that decay. And that's only if we get it early enough. So this is actually a peptide. And what it does, once we clean the surface of the tooth, we paint it on, and it takes 5 minutes. And what it does is it actually sucks the calcium and phosphate out of your saliva onto the tooth and helps harden or remineralize it. And it takes a few months to do it. So when you go back to the dentist, they'll check and take a new x-ray, and they can see if it works. But it's fluoride free, it is painless, and it can be applied in 5 minutes. So it's something you may want to think about with your dentist. It's roughly about £150 per area to use it. But ideally, we stop the decay beforehand. But this is a product now that is pain-free, fluoride-free, and actually will help harden and remineralize your teeth. So it might be something to have a chat with your dentist as well. Other thing to think about, if you're somebody that gets more decay, we found that actually your immune system isn't working as well. So what we all have, everyone has an immune system, and you may know that 70% of your immune function is from your stomach. So if you've got dysbiosis, if you've got problems with IBS, SIBO, or any sort of irritable bowel things, you'll find your immune system isn't firing as well. So one thing you could do is obviously making sure that you're eating loads of sort of fresh leafy vegetables, loads of whole grains, and loads of sort of organic meats and fresh fish as well to help do that. But you want to be looking at all the different things you can have to help your microbiome in your stomach and your gut working. So therefore it will help protect you. And one of the big things, it's actually an enzyme. People call it a vitamin, but it's actually an enzyme. It's called vitamin D, and it's from natural sunlight. But most of us, especially in the UK, don't get enough vitamin D. So we often suggest that people need to have their vitamin D levels tested first. And you can do it really simple. They're like a finger prick test. You get a result in about 15 minutes, and it will show you what your level of vitamin D is. And normally the NHS level of vitamin D is, if you've got this level, you're alive and you haven't got rickets. But for us, in optimal dental health, we want as optimal as possible because we want your immune system working really well. Vitamin D is one of the masters of the immune system. So if vitamin D levels are low, you're going to find that your bone levels aren't as good. You're more likely to get gum disease, more likely to get bleeding gums and gum recession as well. But also you're going to get more tooth decay. So that's one thing we would check for, is your vitamin D levels, to make sure it's optimal as possible. And if it's not optimal, we can offer you an intramuscular injection, or we can suggest supplements you can take that work. And not everyone's supplements work for everyone. So we check your level, do the supplementation, then we check again 3 months later to see what level it is and see, are the supplements working? Are you absorbing them properly? And do you feel better afterwards? Because really, we should be supplementing in the UK all year round. I personally take double the dose in winter, and then I half it in the summertime when I'm getting some sun exposure as well. But most of the time we're not making enough vitamin D. So that's something to check for as well. So if you get a lot of tooth decay, go and see your dentist, get everything assessed first to see what's going on. Look at your diet, look at the frequency of snacking you're having, looking at your vitamin D levels to see if it's optimal as well, to make sure that's going on. And then if you want a deeper dive, you can look at your continuous glucose monitor to actually look at your blood glucose level and how you're responding to different foods and drinks. And then you can also do an oral microbiome test as well, a saliva test, to actually see what is going on in your mouth and see if we need certain antimicrobials, so antibiotics, or we need certain mouthwashes for a short period of time to see if we can rebalance your microbiome, or probiotics or prebiotics as well. So there's loads of different ways that we can rebalance them naturally if you're looking at that. So that's something to do. And one thing I forgot to say is don't use mouthwash. We hate mouthwash. Mouthwash kills everything. And you'll find that then you get more virulent, nastier bugs growing as well. So for us, mouthwash is short-term use. If you've had a curry the night before and you want to get rid of the flavors and tastes, you can use mouthwash. Or if you've got a mouth ulcer or anything going on in your mouth, then you can use a mouthwash for short term, 2 or 3 days, but think of it as like a perfume or an aftershave. It's short term, not to be used all the time. So that will save you loads of money. Get rid of your mouthwash, pour it down the toilet. So we need to talk about what a tooth is, what it's made of, and what a filling does, and why dentists put fillings in. So first of all, this is a tooth, not a real one, obviously, and this is the enamel, which is the hard part of your tooth, and it's actually the hardest substance in your human body, and it's one of the only substances that doesn't regrow. Your skin, every sort of 9-10 days, will replenish itself, your gut replenishes itself, everything replenishes itself, your hair grows, well, mine doesn't, but most people's hairs grow, but teeth do not regrow. So that's the first thing, is we really need to protect this enamel. And the enamel is really hard. It protects us from food, from acids, from damage of the teeth. And what happens with tooth decay is the acid in our mouth can slightly dissolve this enamel and cause a problem and cause decay. So this is the enamel, it's the hard bit on there. Underneath is the dentine. So when you go through, this is a section through a tooth here, the dentine is the bit underneath, and this has got the nerve fibers, and this has all the nerves. So if a dentist drills the top of your tooth, the enamel, you don't really feel it, but when you go into the dentine, that's the bit you can feel, and that has all nerve fibers, and it goes inside to a thing called the pulp. And the pulp is basically nutrient in the way the tooth grows and nourishes itself. And there's blood vessels in there that go from the blood vessels in your face, in your jaw, and there's also nerve fibers, so you can feel it. So if you bite on something that's slightly too hard or too crunchy, you've got sort of feedback, and it tells you, oh, don't bite anymore because you might break it. Well, that's too hard for you, don't swallow it. So you've got these little nerve fibers inside it, and that's the pulp chamber. So if you have really acidic foods or really, really sweet things, sometimes it feels sensitive. Your body is telling you, don't eat it and don't swallow it. So that's one thing to look at here. So you've got the dentine on the outside, and when your tooth is alive and the blood supply is flowing nicely, it can actually repair itself. So the dentine inside can repair itself if it's in the right situation, which means where the pH is more neutral and you're not having lots and lots of snacks. So we want a tooth that's alive. We don't want a root canal. We don't want the nerve taken out. We don't want the tooth taken out. We want a live tooth, and this is what happens. Now, in normal dentists, when you get tooth decay and it's not spotted early enough, or it's gone deep into the dentine, or it's giving you pain, then we need to do something about it. Because what's going to happen is it will just get deeper and deeper and deeper and go into the pulp of this tooth. And when the pulp gets inflamed, you get an abscess, which is a big swelling and a lot of pain. And then you either have the tooth taken out, or you have to have what we call a root canal, which is where we clean all this nerve tissue out, and then we have to fill it, because the body doesn't like hollow spaces. We need to fill it with a material called gutta perca. It's like a tree bark, and it's a resin that fills the void in there. The tooth is then dead, but there's a ligament that holds the tooth into the bone, which is called the periodontal ligament, and that means you can still eat and chew on the tooth, but you can't feel any temperature or anything. And then the tooth can't repair itself, so if then you have lots of acids, it will decay much quicker. So we want to keep this nerve alive. So when you have decay that's gone through the enamel, the hard bit, into the dentine, we need to repair it. And that's when the dentist will drill the area out, disinfect the decay, and then we seal it. Because you're going to have a little hole in the area, you're more likely to get sensitivity, and food will trap in there, which means then decay will accelerate. So we need to fill it with something. So usually it's a white filling, and we use here at Optimal Dental Health BPA-free resin fillings. So we try and avoid as many chemicals as possible in our fillings, and we would seal it over. And if we catch it early enough, we can do it without drills. So we use a thing called air abrasion, which is like a jet wash, and it's a high pressure of powder and liquid, and it cleans the decay, disinfects it. Then we use something called ozone, medical grade ozone, which is basically like oxygen on steroids. It's oxygen that's gone through a filter, and it helps going from O2, which is normal oxygen, to O3, and that will actually help disinfect the area, ready for us to put a sealer over the top of it and put a filling over the top. So ideally, we don't do fillings. We would use Curodon or something to help regenerate your tooth, and we can also use hydroxyapatite, like fluoride, but it's a varnish, and we can paint that on, and that helps your body naturally heal itself. But if it's gone into the dentine and you're getting pain, it's deeper and it's trapping food, we need to seal it. And most of the time, composite resin or plastic filling material is what we use first. Now, if the tooth is very heavily broken down and you've lost usually about half to a third of your tooth, then we need to make something out of ceramic or porcelain. It's much, much stronger, and that chemically bonds to your tooth. So normally your dentist would scan the tooth or take an impression of the tooth, send it to the laboratory, put a temporary cover over your tooth while it waits. It takes about a week, and then we would bring this porcelain sliver and we glue it over the tooth, and it chemically bonds to your tooth, and it helps strengthen your tooth and keep it so you can bite and chew on it and make it look like a tooth. So that's what we call inlay is, where it goes inside the cavity. If it's less tooth, if there's bigger cavity and there's less tooth structure left, we might do an onlay, which is almost like a top hat that covers over the tooth. And if the tooth is really damaged, there's not much left of it, then we put a cap or a crown that covers the whole tooth, goes down to the gum. Again, we don't use metal here, so it's all metal-free ceramic options. So they're the options to rebuild the tooth, but we're going to step right back and we want to try and avoid that. And we avoid that by going through the workbook, by stop snacking, by looking at your pH in your mouth, looking at the microbiome, and also looking at your vitamin D levels, brushing twice a day using interdental aids, and making sure that you feed foods like probiotic foods that actually help nourish your teeth and things like that. And if you're interested, we also have, I've written a book called Kick Sugar. It's a cookbook. It tells you all about how tooth decay happens, gives you loads of tips and tricks about how to avoid cavities, but it also gives you 2 weeks worth of recipes. You've got breakfast, lunches and dinners for 2 weeks, all great food that you can cook with your family, but it also nourishes you and helps your body grow and develop. All tastes great, but it also has either no or very low sugar in it. And so that's something you might want to do. And for all the people watching on this video, I've got to download the workbook. We're going to give this book for free. Okay, that's free, no cost. All you have to do is pay for shipping. So if it's in the UK, it's around £5. So put in your address, we will ship it out to you, and just pay for the shipping, and the book's for free. So hopefully you'll enjoy that and share that with your friends and family, and you'll save this workbook and you'll redo the video, because there's loads of information about that, and you'll learn more and more about it. And hopefully no dental bills, no tooth decay, healthy smiles. That's what we're looking for. We're going to talk about how we can stop you having the dreaded root canal treatment. We do everything in our power to try and help your body heal itself. So we're going to use metal-free restorations, we're going to clean things with ozone, we're going to disinfect your mouth as much as possible, we're going to teach you about anti-inflammatory diet and making sure you're not snacking on high sugar, high carb foods. But if you've got a deep cavity that's very close to the nerve or it's giving you sensitivity, what can we do about it? So first of all, we want to clean it as quickly as possible to get rid of any of the bugs. So we use ozone to disinfect it and get rid of any of the sort of decay. And then once we got down to healthy tissue, sometimes we can see the nerve underneath, or we call it the pulp, or the nerve vessels. So you can see some bleeding, or you can see some redness underneath it. And what we're trying to do is work with your body, not against your body, to try and put you into that healing state. So that might be making sure your vitamin D levels are really good, making sure you're eating better, you're sleeping well as well, so your body has natural sort of healing properties, because most of the healing happens while we're asleep. And you can't biohack sleep. So people say little supplements for it, all different things, but most adults need 7 to 8 hours of sleep every night. And the only processes that happen while you sleep only happen while you sleep. So you can't repair cells and things during the day as well as you can at night. So good sleep is the first thing. And when somebody comes to me, we've cleaned everything out, if we're really worried about the nerve, we can use something else. And we're starting to look at bioactive glasses. There's one material here called Biodentine. There are other materials as well, but this is the most researched one out there. And what we would do is, when we clean out the cavity, if we're worried about it, we put this material in. And what it is a dentine substitute, which is basically part of your tooth. Dentine is the root surface of your teeth, and this is a natural, it's called a bioactive glass. And what it does is it helps prepare your tooth and actually help it heal itself as well. So it's almost like a sedative to calm the nerve down and allow the natural tooth to repair around it, and hopefully then avoid the dreaded root canal or extraction. So when it's really, really bad, we fill the whole tooth up with this Biodentine, and then we come back a few weeks or a few months later and then go in and put a filling over the top. But if it's not too bad, we put the Biodentine as a layer, as a protective cover, and then after that, We then put the filling over the top of it, and then we review you in 6 months and a year later, and we take an x-ray after a year, and we're looking for healing. We're looking that the ligament is not inflamed, looking no signs of any infection, and also you can eat and chew and everything on it. And that's what we're trying to do, to try and avoid a root canal, because we don't want the cost of the root canal. We also don't want you to have a dead body part in your body. And a lot of people, that can cause reactions in other parts of their body as well. So we're trying our best to avoid a root canal or an extraction. And the best way you can do that is whenever you've got any symptoms or anything, go and see your dentist as soon as possible. Don't allow it to linger and go on. If you're getting sensitivity in the tooth, get it checked out, get it checked to make sure there isn't a cavity, and then ask them to use something like this Biodentine. Usually it's about 150 to 200 pounds extra to use this material. It takes 15 minutes to set. There's a whole process involved in it, but it's a magical material and works really, really well at helping your body heal itself. So we're looking at all the different things we can do: sleep, hydration, exercise, making sure you're eating and drinking the right things, and trying to have your body in the best state, because if the whole body is inflamed and infected, your tooth's going to get infected as well first. There's a big connection with it. So try and go through the workbook, look at your sleep. You can use trackers like something like an Oura Ring or Apple Watch or Whoop Band or something to track your sleep, to see, one, how much sleep you're getting. Ideally, you're going to bed at the same time and you're waking up at the same time, whether that's a weekday or a weekend. Your body likes routine, and what we find is when you wake up in the morning, your melatonin levels are quite low, cortisone is really high, and what happens throughout the day, it drops and drops and drops to cortisone, and melatonin gets builder and builder and builder, ready for you to get tired and go to bed as well. And the body doesn't like it if you're going to bed and waking up at different times. It gets confused. That's why when you go in different time zones, it really screws up your sleep. So trying to go to bed at the same time, wake up at the same time, try and have like a 90-minute wind down before bed. We find, like kids, we used to have hot milk, we used to have a story, we used to have a bath before bed, and that helps switch your brain off. If you're somebody that's brain is constantly active, your body is not going to have chance to get ready to that sort of rest and repair stage. We call the parasympathetic stage. So what we're trying to do is get that 90-minute sort of gradual decline, getting off screens. If you are watching TV or something, try and use the blue light blocking glasses as well. There's night mode on your phones you can put on as well. Try and read a book. Try and have a bath with mineral salts or Epsom salts as well. Helps really calm you down. Some people lavender. And then making sure your bed is a sort of calm area. It's dark, it's cool, because the body temperature drops before bed as well. Some people have a tea. I have a thing called a yogi tea before I go to bed, which just helps calm me as well. And then I sleep with this sort of paper and pen by my bed. So just before I'm going to bed, if I suddenly have an idea of something, I'm going to scribble it down, put it on a piece of paper, and then I can go to sleep knowing that that idea doesn't have to stay in my head. I've got it written down there. And then in the morning, you sort of wake up. So you have to think on your form, write down how you feel when you first wake up. Do you feel really excited, really energized, ready for the day? Or are you really tired? Do you need your coffee to get woken up? So you go straight on your phone as the first thing and then get these endorphins flowing through your system. What do you do? And ideally, get out into daylight or fresh air, and within sort of half an hour of waking up, having water, and looking at gratitude and journaling and things like that. And there's a great book about mornings routines and what you do first thing in the morning. So if you're interested in that, that might how it's called the Miracle Morning, and so have a look at that if you're really interested. But it's really working on repairing, because we can do, as dentists and holistic dentists, we can do a lot to repair your mouth, but we need the whole immune system. We need all the repairs working, and that's all about sleep, that's hydration, that's reducing stress as much as we can, and that's eating right, and also movement. The body likes moving, and sitting still behind a desk is not great. So seeing if you can get your 10,000 steps a day, or going out to the gym, or whatever works for you. Some people it's doing a HIIT class or doing a tennis lesson. Other people it's just going for a brisk walk around the block. So whatever it does to you, to try and help, because that makes a huge difference to how well our dental care goes. So you've got enough homework now. I'd love to hear in the comments how your sleep's going, what you're doing to help repair the inflammation in your mouth, but also the inflammation in your whole body.
I hope you enjoyed this, and it was great spending some time with you.